Hi, my name is Zion Johnson, and today I'll be doing a BSN Vital Signs reassessment video. And today I'll be working with Dejanae Barker. Dejanae, do I have your permission to record my session?
Yes.
Perfect. So to begin with, I will knock on my patient's door, and I'll introduce myself and let my patient know what I'll be doing with them today, and I'll perform hand hygiene. No. Hi, my name is Zion. Today I'll be your nurse and I'll be doing your vital signs assessment for your provider. I'll do hand hygiene. May I have your first and last name and date of birth?
Dejanae Barker, 11/4/99.
And may I see your wristband to confirm your identification? I'll confirm it, and then we'll begin with, I'll begin with taking your pulse. May I see your left hand? So to begin with, I'll take my two fingers and I'll place them against her radial artery. Her radial artery. And I will count for 30 seconds, and then I'll multiply by 2. Okay, so I got your pulse rate at 82 beats a minute, at 41 beats in 30 seconds, so I'll multiply by 2, that'll be 82 beats per minute. And her pulse was not bounding or thready, it was regular. And so I will take your pulse again, and I see your left arm. And this time I'll use my left hand and 2 fingers, and I'll place one hand behind the back. And I'll count for 30 seconds. Okay, so in that moment I counted 10 respirations in 30 seconds, and I'll multiply that by 2, that was 20 respirations in 1 minute. And so then her respiration depth was not rapid, and it wasn't extremely deep, it was regular. And so then next I will take my patient's left forearm, and I'll feel down her brachial artery, and I'll find it. Okay. And I'll take my blood pressure cuff and apply it to my patient's arm. And Dejanae, can I have your average blood pressure?
120/80.
Make sure that there's 2 fingers worth of space between my patient's arm, and that the blood pressure cuff is 1 inch above her the midline of her arm. Okay, and then we'll move forward just so that you can visually see the spirometer for her blood pressure. Okay. Now I'm going to take my stethoscope and place it on the brachial artery, making sure to keep away from the blood pressure cuff. And I'm gonna inflate it 30 millimeters mercury past her systolic to begin. Okay. Okay. So I got 122 over 80, which is a little bit over her regular blood pressure. So it is a little hypertensive, but there's no cause for concern. Also found that her blood pressure was not, or her systolic wasn't too high. I measured starting from the first beat at 122 and heard the last beat at 80. And Dejane, I'll report this to your provider. Do you have any other questions before I step out to speak with your provider?
No.
Okay, perfect. So I'll do hand hygiene and I'll exit and record my patient's vital signs to the provider. Thank you.